Spilling the Beans digital health podcast is aimed at members of the digital health community globally, with guests from the United Kingdom, Australia and the United States. The podcast is available through all major podcast distributors as well as on YouTube. The show is sponsored by Woodrow Mercer Technology and Woodrow Mercer Digital Health.
Hi everyone, I hope you're well. Welcome to Spill the Beans Digital Health Podcast. My name is Duncan Goldie. My guest this week is Paul McCallum, who is the Director of Customer Acquisition with Babylon Health. If you don't know who Babylon Health are, I'm not entirely sure where you've been over the past 5 years, but they've rapidly become, the UK's leading digital healthcare service, and they've expanded internationally. Paul will talk you through in a lot more detail, quite how much success they've had, but it really is staggering, but obviously well deserved for a company that has spearheaded and revolutionised access to healthcare. They've spearheaded the remote consultation service which is being offered, and they've got lots of really good agreements in place for corporate customers and things like that as well, to be able to benefit their employees. So I know that's being rolled out in America, and so it's interesting to hear about what's going on there. So without much further ado, I'll let Paul explain the rest.
Great, Paul. Thank you so much for taking the time to have a chat with me on the podcast this afternoon. How's everything going with you? Whereabouts in the world are you right now?
So I live in Chelsea in West London. So experiencing the choice of lockdown. Yeah,
exactly. I'm sure there's a few people who'd rather be in lockdown in Chelsea. What's your working from home situation like? Are you by yourself or?
So I'm married, 2 small dogs. So that brings its own problems when we're both on conference calls at the same time. So obviously the dogs don't know we're on conference calls. So we have to share the responsibility. So right now my wife's actually got both my dogs upstairs. You hear some barking, and you know what it is. That's what happens.
Okay, we'll try not to ask too many questions if we hear some strange noises. Great. Well, yeah. Look, I suppose firstly, if you could just kind of give us a bit of an introduction to yourself and your role at the moment.
Yeah. So I've been Director of Customer Acquisition at Babylon Health, and I've been for just over a year and a half, which has seen a lot of, you can imagine. Before Babylon, I used to work as an economist. So I went from selling subscriptions to selling health subscriptions, in fact, in some ways. So still very much a subscription model business. Obviously a very different audience in some ways, and a very different product.
Yeah, exactly. You mentioned there that obviously the growth that Babylon has come through over the past, I suppose, 18 months. But how was your role when you joined the business? Was that a new role to Babylon? Were you joining as an existing team, or and how has that kind of developed in the growth of the platform over the past 18 months?
I think when I joined Babylon, there was literally about 4 or 5 permanent people in the marketing department, who contracted well, and so it was a new role that I joined to, and we were also very UK focused as well back then. So I guess the big change has been obviously we've grew the team. So we now have around about 35 people who work in marketing, and almost all of them are staff as well, with any freelancers anymore. So we've really changed that around. And then the big change is that we've obviously started to expand into new countries. So we went from being just live in the UK and Rwanda, really when I joined, to now covering the US, Canada, plus several countries in the APAC with potential, and looking to expand further into Brazil and other markets in the next weeks and months. Yeah,
perfect. And so, during the sort of COVID pandemic, has that, the platform, I imagine it's used in slightly different ways within each kind of jurisdiction. How have you seen the kind of versatility around the platform, and how is it being implemented in different areas?
The key things we obviously noticed spike in people wanting telemedicine consultations because of COVID, which kind of makes sense. People don't want to leave the house, so we obviously seen a spike in that. But one of the things that has been amazing at doing is pivoting very quickly, and we realised that we could actually crisis by building what we call our COVID care assistant, and the product team turned this around in a matter of weeks, and produced basically a care assistant that would obviously help you diagnose if you had potential COVID-19 symptoms, then provide you a way of sort of tracking your symptoms to monitor functionality, give you the chance to chat to a professional expert. And then if you needed to speak to a doctor, you could speak to a doctor. So it was almost trying to triage people away from going straight to a doctor's consultation, if that makes sense. And we've had a lot of success in various countries with that platform in terms of rolling it out. So we're in the UK, we're also in the US with it. We're also looking at Brazil with it as well.
Perfect. So, I mean, in terms of the actual, functionality of the platform, it sounds like, obviously the taking people away from, the GP and the emergency room is obviously the first point of call. Do you see the platform developing, and obviously the platform is going down the path of developing a lot more different aspects to it? Is there anything that's sort of in the pipeline that you can talk about right now, which is going to be the kind of next step for Babylon?
So I can touch on the fact that if I go back to what we've focused on in the UK, we've been doing a lot of work with various NHS trusts where we are basically helping them to triage their patients. So the goal here is to stop people going to A&E if they don't need to, basically, if that makes sense. And we do a lot of work on that. And obviously that helps relieve pressure on the NHS and what can be like a really busy time. And so that's one of the things that we're really closely working with. We actually cover 80% of the population in England right now. Wow. In terms of provide, and we're hoping to roll that out further in the next few weeks. But we basically cover a lot of the West Midlands, so Birmingham and Wolverhampton and places like that, plus Berkshire as well. So we've done a lot of great work there. And whilst we've moved internationally, the NHS is still like a really key partner for us. So we have our GP at Hands in the UK, which has grown enormously since I've been here. We're one of the biggest GP practices in the country as well now. So that's where we actually look after everything for the physical clinics as well as the telemedicine. I want to stress just a telemedicine app as well, which a lot of people might see us as. So we really are focusing on becoming what we call integrated care, which is looking after people not just when they're sick, but also when they're healthy, and trying to make sure that they've got this in mind as well, if that makes sense. To try to keep people from needing to use our telemedicine services, and so hopefully reduce the cost of healthcare around the world.
Yeah, definitely. I mean, I suppose that perception is quite real at the moment, with Babylon being, quite often perceived as an app on your phone that you kind of go to for, a bit of a medical consultation and not much else. I mean, how do you think it's going to be, say, post-COVID? How do you think Babylon is going to be perceived, and how are you going to get across that kind of one-stop shop? Is it going to be through the uses of different types of technology, or is it still going to remain that kind of, easy to access platform, which is obviously why it's got itself into the situation it's in now?
So I mean, I think the real challenge for Babylon is how do we join up the different parts of so. And by that I mean obviously your frontline services like being a GP as well, but also if you go to hospital, and how do we join that together as we call integrated care, and that's what we're working on really hard right now at Babylon to make sure we make that happen. And we feel that we're in the best place to do that. We're the only join these pieces together, and I'm very confident in the next few months you'll see some great strides towards doing that.
Yeah, exactly. I can imagine from I suppose a legal and I suppose governmental standpoint, the data that you're collecting here and everything like that, and how that's to be used inside the hospital when someone does have to go to that next step and unfortunately does end up in hospital. Is there any kind of different way from which you're able to sort of pass over that information? Is that where you see the kind of next step coming from in terms of this sort of the more, rather than just remote medicine, it's taking that next step into the physical medicine area as well?
So that's probably not something I want to discuss right now, because I am not that close to my particular role, if that makes sense. I don't work in the product team, and so I don't want to get an answer that I wouldn't be 100% sure is accurate more than anything else.
That's it. You've been briefed well beforehand, don't worry. Great. So, I mean, I guess it's more sort of generally from the digital health community. I mean, new digital health businesses are propping up all the time. Obviously, Babylon seems to be spearheading that. And a lot of businesses are learning from Babylon as well. Is there anything that you think Babylon seems to be picking up from the newer businesses or from the competitors, particularly around that use of technology?
I think personally, from a marketing point of view, it's always interesting to see what your competitors are doing in terms of communication tactics, in terms of what creative they might use, and so on and so forth. So I think from a tech point of view, we see ourselves as being a company that wants to set our own tech, if that makes sense. So, but from my own marketing position, we definitely look to see what competitors do, make sure we think they're useful for us to grow the brand and to improve our acquisition.
Exactly, yeah. And how has it been from, more of a sort of operational perspective, you guys adopting to the remote ways of working, and how has that impacted the kind of projects that you had ongoing previously in the marketing team?
So I think we actually left the office about a week and a half, 2 weeks before the official lockdown. So we almost had a bit of a head start, I think. And I think it's went remarkably smoothly for the most part. We work on 99% of the time pretty well in terms of so on and so forth. And I've not been hacked in any of my Zoom meetings so far by gate crashers. And I guess because we use like Google Drive and stuff like that, and Google Sheets, they're interactive documents anyway, so work on a deck together that it's been updated in real time, or if you're even producing some data to be analysed, you know that the data is up to date and correct. One of the things I think a lot of businesses will be asking is do we need to have such a big office when people start to go back, if that makes sense? Yeah, it'll be great to have an office for catching up and having meetings when you have to have face-to-face meetings, but everyone in the same place all the time. I guess that's a question that a lot of businesses will be asking at this moment.
Yeah, exactly. I mean, no one seems to have any of the answers or anything like that, but it does seem to be. I don't think nothing's going to go back to the same as it was previously, prior to this pandemic. But I think, in a positive way, it seems to be that a lot of businesses will be adopting more of sort of flexibility around where you can do your work and everything like that. Are you seeing the same levels of kind of productivity and everything like that from your team?
If anything, I would say our product guys have been even more productive than ever in the past couple of months. And from a marketing team perspective as well, we've been able to produce some amazing creative, even though we haven't been able to get video shoots and stuff organised. Just some amazing content, even though and for the guys in my team who spend money, accessing Google or Facebook or Snapchat, you don't need to be in an office to do that. That's something that can be done remotely, if that makes sense. So I think I've been really impressed at the productivity levels we've maintained.
Yeah, definitely. And I suppose, to sort of sum up, what's the next steps look like then for Babylon and for your kind of, you touched on the fact that it's changing. It's going to become more of that one-stop shop for all aspects of medicine and not just telehealth. From a marketing perspective, that's obviously a challenge. Do you have a roadmap in place for the next, 6 to 12 months?
So the focus for marketing and for business in general is to obviously establish yourselves more in the US, and literally this week launched a partnership with Mount Sinai in New York, where people in New York who are on one of the Mount Sinai plans can now access Babylon for free through our app, and that's a huge start for us to sort of make ourselves established. Other partners in the US as well, and the roadmap will be how do we roll out across various states the next 6 to 12 months and help obviously build a brand for Babylon in what is a very competitive marketplace.
Yeah, definitely. I suppose there's a whole new breadth of challenges in an area like the US and probably learnings that you can definitely take from there into other areas as well, as we're very fortunate in the UK to have the NHS, but a lot of other countries don't have that sort of access to healthcare. Is that a kind of main focus for Babylon as well, to have that, access to healthcare for everyone?
Yeah, well, our company mission is to make healthcare available and affordable to everyone in the planet. And that's whether they live in a rich country like the US or the UK, or whether they live in what we would class a poor country, dare I say, Rwanda or some other. That makes sense. So that is our mission, and we've always been very firm believers in that. And the reason the US is so important is that $1 in every $3 it's spent in healthcare in the world is spent in the US. And whilst the US has got a lot of people, it doesn't have like 33% of the world's population. So the US is obviously a key market to be a global player. You have to do well in the US, and obviously if we can do well in the US, it will help us do better in other countries as well, if that makes sense. The revenue that we're taking up.
Yeah, exactly. Is there anything more that you think that you'd like to see from either, I suppose, a governmental approach or from other digital health businesses to kind of help, get that traction globally in both, first world and developing countries? Is there more that you think can be done?
I think from a governmental point of view, again, it's not really my area of expertise. I have to caveat that yet. But I think like the one thing perhaps that COVID has made really clear is that a lot of things that we thought couldn't be done digitally can now be done digitally, whether that's working from home or whether that's a doctor on the phone. There's a whole host of things that we in the past would have thought, oh, you can't do that on a mobile. And I think like we've had a bit of a mind shift in that sense. And I think government should make return to normality. That we keep that sort of digital first aspect, and that's not just for healthcare. I think that's across a whole host of things, because that will be good for not just different people in society, but it will also be good for the planet and things like that as well. It should be more environmentally friendly to do a lot of these things rather than force people to commute to an office or commute to a GP surgery or commute to a hospital. So I guess that's one of the things that I would hope any government in any country will do, is to make sure they facilitate sort of a digital first approach going forward.
Yeah. It sounds great. You've obviously mentioned a couple of different aspects of the marketing and stuff like that. What's the best way for people to stay up to date with the latest releases about Babylon and all the good work that you're doing?
Obviously you can visit the website, so babylonhealth.com. Bit of a plug for us there. But obviously we're obviously on iOS and on Android, and we have an app that's available in almost every country in the world. So certainly go to the App Store and search for Babylon Health. You should be able to download it, and the app is free to use for almost all services. Obviously, speaking to a doctor will usually have a fee unless you're with the NHS, for example, or you're in an insurance plan in the States. But the ability to use our symptom checker will normally be free across every country, and our health check functionality as well, which sort of helps you understand your chances of developing diseases in your life, will be free for most people to use as well. So I would say go to the App Store and download our app, and also check out the website and our blog.
Perfect. Well, look, Paul, thank you so much for taking the time to have a chat with me. I'm sure there'll be a lot of questions that people will have off the back of this. So, fingers crossed you don't get too bombarded. But I think it'll be really informative for people to see what's going on behind the scenes of, one of the, I suppose, fastest growing digital health organisations. And it's really interesting. So thank you so much for taking the time, Paul, and enjoy the rest of your day.
Thank you very much. Cheers.
Cheers. Have a good one.
Okay, and that's a wrap. Thank you very much for Paul for taking the time to chat with us. Really interesting to hear from him, and obviously get the views of someone inside an organisation which is under such a spotlight at the moment. But really appreciate him taking the time. If you do have any questions, you wanted to reach out to Paul, his contact details are in the summary of this, as well as mine as well. So if you're keen to reach out to me and discuss anything, then I'll be very interested to speak to you. So I hope everyone stays well, and I'll speak to you all soon. Cheers.